So, let's talk about a drug that is both a lifesaver and, well, a potential poison. It's a modern medicine that we get from an ancient, beautiful flower. This is the incredible story of Digoxin, truly a double-edged sword in the world of heart medicine. Our story starts right here with this really vibrant plant, the foxglove. For hundreds of years, healers knew that if you made a tea from its leaves, you could treat this condition they called dropsy, which we now know is the fluid buildup and swelling you get from a failing heart. They knew it worked, they just had no idea how. And that's really the big question for us today, isn't it? How can a chemical from a plant get right down into the machinery of our cells and actually change the way our heart beats? The answer is, well, it's a brilliant but also slightly dangerous piece of molecular engineering. Okay, to really get this, we've got to shrink ourselves way, way down and go inside a single heart muscle cell. We're going to take a look at the tiny engines that make every single heartbeat possible, and we'll see exactly how digoxin gets in there and takes over the controls. All right, meet the star of our show, the sodium-potassium pump. The easiest way to think of this thing is like a tiny, tireless bouncer at the door of the heart cell. Its whole job is to constantly push sodium out and pull potassium in. This back and forth creates this perfect electrical balance that the heart absolutely needs to beat. It's fundamental. So here's the clever trick digoxin pulls off. It's like a four-step domino effect. First, it just walks up and blocks that sodium-potassium pump. It just shuts it down. With the main exit blocked, sodium starts to pile up inside the cell. Now, this sodium traffic jam messes with a second pump, one that's supposed to push calcium out. That one slows way down. And this is the magic moment. With all this extra calcium just hanging around inside the cell, the heart's muscle fibers can grab onto it and contract with way more force. Suddenly, a weak heart gets a huge boost in strength.
So this one little mechanism actually gives digoxin two completely different jobs in medicine. It's not just about making the heart beat stronger, it's also about making it beat, well, smarter. Let's break down how that works.
And this really shows you the drug's split personality. On one hand, for heart failure, that stronger pump action helps push blood around the body better, which eases symptoms like fatigue and shortness of breath. But on the other hand, for a chaotic rhythm like atrial fibrillation, digoxin also messes with the heart's electrical wiring. It slows down those crazy, rapid-fire signals, bringing a runaway heart rate back under control. But, and this is a really critical point, for patients with heart failure, digoxin is great at making them feel better. It keeps them out of the hospital. That's huge. But the major studies have shown it doesn't actually help them live any longer. It's a quality of life drug, a symptom fixer, not a life extender. And this leads us right to the central problem with digoxin. The very thing that makes it so effective is also what makes it so risky. You see, there is an incredibly fine line, a dangerously narrow window between a dose that helps and a dose that harms. The official term for this is a narrow therapeutic index, and all that means is that the dose that works is just a tiny bit away from the dose that's toxic. You know, with a lot of drugs, you've got a big margin of safety. With digoxin, there's basically no wiggle room at all. I mean, just look at that number, 0.5 to 0.9 nanograms per milliliter. A nanogram is 1/billionth of a gram. That's the tiny microscopic window in the blood where this drug is helpful. Go just a little bit over that, and the danger of toxicity just skyrockets. And if you do go over, the signs of an overdose can pop up all over the body. You can get nausea, confusion, but the most famous, kind of bizarre sign is visual. It's a condition called xanthopsia, where patients literally start seeing strange yellow-green halos around lights. But you know, while all those other symptoms are bad, it's the heart toxicity that is truly life-threatening. The same exact drug that can control a bad heart rhythm can, at high levels, trigger almost any arrhythmia you can imagine, including ones that can kill you. Thankfully, modern medicine has an emergency exit. This is the antidote, Digoxin Immune Fab, and it is an amazing piece of biotech. It's basically a highly specific antibody that's designed to do one thing: hunt down digoxin molecules in the blood, latch onto them, and neutralize them so your body can get rid of them safely. It's a genuine lifesaver. So after all that, you've got to be wondering, with all these risks, where does digoxin even fit in today? Why are we still using a drug that requires this constant, delicate balancing act? Well, the truth is, it's not the first drug doctors reach for anymore, not by a long shot. It's become a very specialized tool. It's for those patients who are already on all the best modern heart failure drugs, but they're still having symptoms. That's when digoxin might come off the bench. And using it safely means constant monitoring. I mean, you have to stay on top of it. Doctors have to regularly check the drug level in the blood. They have to keep an eye on kidney function because that's how the drug gets cleared out. And they really have to watch electrolytes like potassium, because if your potassium gets too low, the risk of toxicity shoots way up. And a huge reason for all this caution is just how long this stuff sticks around. It has a really long half-life. It takes about 2 full days for your body to clear out just half of a single dose. That means it builds up really slowly, and it also leaves really slowly. So any tiny mistake in dosing can have consequences that last for days. So that leaves us here with this one last question. Is digoxin just an old relic we should probably move on from? Or is it a reliable, if kinda high-maintenance, specialist that still has an important job to do for the right patient? The answer, it seems, is that it's a little of both. A perfect example of medicine's incredible journey from an ancient plant remedy to precision, high-stakes pharmacology.